Good morning, everyone. Welcome to the second half hour of Atlanta and Company. I'm Christine Pilara. So great to be with you. In health news this morning, providing the proper care for our loved ones is never an easy task. More importantly, it can be very expensive. And what if there was a way to receive that care, though, in the comforts of your own home? And what if it was actually affordable? Well, that's where Visiting Nurse Health Systems shines, and that's where we're going to learn more about it today with Vice President of Advancement, Mary Norman. Mary, thank you for being here.
Thank you.
It really is so important. So many of us, we're aging, we're living longer, and this is where your company comes in to help in those years as we enter into those sometimes complicated situations with our loved ones. So talk about what your health system does.
Right, absolutely. Well, we're the leading home health care and hospice provider in the greater Atlanta area. And as you mentioned, we care for families and individuals in their home where they're most comfortable and actually where the outcomes are best. Everything from skilled nursing to long-term care to hospice care. And hospice care is provided in the home and also at our hospice center in Buckhead, which I know we're going to talk about as well.
Yeah, that's wonderful. But I noticed that you're a nonprofit. What does that mean?
We are. It means we care for individuals regardless of their ability to pay. And those that we do care for are always the sickest. They're what we call the at-risk patient, those that are most likely to need to return to the hospital.
Right.
And so the cost is greater as well. So we're actually the safety net in the community for the vulnerable patient that needs our care. And without us, there really wouldn't be anywhere to turn except for, expensive care facilities, which they might not be able to afford.
That might not be an option, or it sounds like it wouldn't be an option.
Exactly.
And of course, this leads us into, I'm sure, on everyone's mind as we are going through so many of these situations with our loved ones, the Affordable Care Act.
Right.
How does the ACA impact your work?
Well, we don't know when the Medicaid expansion will take place throughout our state. There are 700,000 uninsured Georgians, but we do know that when it does, Medicaid is only going to cover 40 cents on the dollar. So that additional cost is still going to put a financial strain on, vulnerable individuals. They're not going to be able to afford it. So again, we're the safety net, even with Medicaid expansion.
And let's talk a little more about the program specifically and the people that you serve.
Yes, it's a full continuum of care. In our hospice program, for instance, we work with families like expectant mothers when the parents may find out that their child is not going to survive long term, the tragic news when they receive that, to counsel them and work with them before the child is born. And then also after an individual passes away, we work with that family for 13 months to counsel them and help them.
How wonderful.
So it's full service, and we have social workers, doctors, nurses, home health aides, chaplains, a full team, because hospice is really not just about that individual, it's about the family and helping to support them.
Wow, that's incredible. And talk a little bit, you just touched upon it, about the Hospice Atlanta Center in Buckhead.
Yes. It's a jewel. The Hospice Atlanta Center is a place where the acute patients, those that need 24-hour care, can stay. And it's a gorgeous facility.
Really
it's just like being at home. We try to make it an extension of the home for the individuals and make it as comfortable as possible. The grounds are lovely. We have a beautiful rose garden, and so the patients and their families can go outside. We also make it very comfortable so that families can stay with us or stay with their loved one while they're with us. They can bring their pets as well, and of course children are always welcome. The rooms are really special too, because each room opens out into a courtyard, and so the beds can be rolled out into the courtyard.
How wonderful.
It's wonderful, and so they can enjoy the sunshine, and it's truly like being able to be in your own backyard, and special for the families too. We do birthday parties, we plan dinners for the families, as I said, bring the pets in, whatever we can do to make it comfortable and feel like home.
I've never heard of that aspect of elderly care and being able to, because they're so confined and they feel so lonely, being able to go outside.
Absolutely.
And talk with the family or just look at taking the fresh air. How wonderful.
Yeah. And in addition to the hospice program, we have 750 staff that work out in the community providing the other care, the skilled nursing care, physical therapy. So again, it's a huge team. We've been part of the community for 66 years, and we serve 28,000 patients a year. So we make a big impact in the community.
Caring, loving staff.
Absolutely. They're amazing. And the things that the degree that they go to make folks comfortable is really inspiring.
Yeah. And it's so important. And your services, as you mentioned, so comprehensive, greatly needed. So what can we do to get involved? What can our viewers do?
Right. Well, of course, financially supporting our programs, we greatly appreciate. But we need volunteers also. We have an event coming up this fall, In the Moment, a Celebration of Life. It's a fundraiser for our hospice program. It's October the 16th at the Piedmont Driving Club. And we would love to have your viewers attend.
Nice.
Companies support us. And we've create a special place on our website when you go there that you can find out more about how you can participate in that. And then also on the hospice side, there are opportunities to do something as involved as get training for a 16-hour program where you can work directly with the patient, so you can sit at bedside.
Right.
Many people don't have anyone as they're passing away. Their family members have passed away or friends, so that's a really special program. But also in-home, you can walk dogs, you can go shopping. There are so many things that you can do. You can cut hair if that happens to be your skill.
Right.
So we can find a spot if someone wants to be a part. I would love to talk with them personally, and so if they do visit our website, they'll find information on how they can get in touch with me, and I'll talk with them and we'll put something together.
Mary, thank you so much. We appreciate you being here and making us more aware of it. And again, I'll repeat that website. If you would like some more information about visiting Nurse Health System, please give them a call right now. It's 404-215-6015, or you can log on to their website. It's vnhs.org/hospice. And once again, go to the website, see how you might be able to help.